It's week 4, level 2, and it's a Saturday party, and I love doing these coaching cues, not only for the individuals in the room who joined the Zoom room so that I can give you coaching cues, but also for the Hypoxix community, the Hypoxinauts, to learn about this methodology and how I like to teach and cue. And so if you didn't make it to class, you can hear about the things that we worked on. But then additionally, I do post these on YouTube, on the YouTube channel. And so the greater community can just get something out of learning about exercise and how, what kinds of things that I focus on in my workouts. So here we're starting with something called the painless circularity combos. Now, I am having everyone close their eyes and pretend like they're pulling gloves up their arms. This is for the purposes of activating the baroreceptors, the pressure receptors in the body, which sometimes can help reduce pain temporarily. And so we use that as a warm-up, using that skin touch, that touch sensation. It's really, really powerful. Now, to begin here, we are starting with some cardio. This is the cognition cardio portion. This is getting that heart rate up and also increasing the activity of the mind and decreasing the decline of cognition, which happens to all of us as we age. So patterns like these, foot agility patterns, really can help to prevent that decline. So here, everyone has their ab ribbon on. We're ready to go to breathe with the, with that cardio. So here, hexagon on the ground and going wide, center, front, and center, kind of like doing hopscotch, but this is low impact. And the reason how we're keeping it low impact is we're keeping those legs pretty bent, staying pretty close to the ground, and reducing vertical displacement. Vertical displacement is the amount that you move up and down in space, and the more you do, the more impact on the body. So I aim to reduce vertical displacement in the workouts, and if we do jump, we do a low impact jump with no sound on the landing. These teasers look awesome. Mindy, you can you can think about making sure the arms get as straight as possible as you go overhead, and reducing the braking at the wrist joint, meaning try to keep the wrist as neutral as possible when you're holding on to the band, because it's easy to not be in neutral. And because we do so much band work and wrist work, we want to make sure that the wrist is in neutral, because if the wrist is not in neutral, just like the low back or any other joint in the body, and you don't work it, and it should be worked in its full range, but also emphasizing neutral when it's under load or when resistance is placed on it, that's just going to help minimize the wear and tear and also overuse injuries, like tendonitis in the arms and stuff like that, because we are doing a lot of gripping in the workout, in any workout, just holding weights and holding bands. So always ask yourself, what is your wrist doing when you're holding bands and you're holding weights? It's important. Are you equally gripping with all fingers? That's going to help distribute the force, and all the muscles helping one another out. So you want all of your muscles to be friends, all of the muscles to help each other out, so that you're distributing the load amongst all the muscles and not just relying on one or two muscles to take up the slack for the others, which that's one of, a huge cause of overuse injury. Here, Carol, make sure that the arms stay straight so that you're not using your biceps as much to get those weights up, but actually using momentum in this balancing exercise. And remember, balance is for not only the balance, but it's also for the brain. We are preventing cognitive decline by working balance. Really nice job, Adele, with keeping that knee in line with the band around the knee. I do that to work on knee alignment and really work on that vastus medialis oblique, that inner quad, that helps to prevent knee injuries, especially for someone who suffers patellofemoral syndrome. That can help the lateral drifting of the kneecap, which is a main cause of knee pain, right? That outer quad just pulling, all those structures pulling the kneecap out laterally. Really nice work, Carmela. Try to keep your right hip back a little bit more when you do that lunge. That's going to help you feel the glute and the right hamstring more, hamstrings for plural. The knee is going a bit too forward, and you might emphasize quadricep a little bit too much in that one. You're going to get quad regardless, but I like to employ certain cues to help increase the activity of the hamstring and the glute, just so that you don't feel hip impingement in the lunge, right, in a lunge exercise. This is a great push-up and overhead press exercise using hip mobility. Integrating hip mobility rather. Really nice 45-degree angle with the arms, Nicole. Make sure the elbows don't go back behind the rib cage when the arms come back. So think on the eccentric component of the exercise. That's when the control of the arm, of the humerus, and all of the structures, the shoulders and everything, is really most important, especially against the pull of the band. Really, really nice work. Carol, the arm placement is great. But Carol, make sure that you don't break at the wrist joint as well. Think, ask yourself, are all the fingers gripping equally, and are the arms in line? Carol, pretend like you're squeezing a towel between your arm bone and your rib cage. In fact, do squeeze a towel in between, squeeze it in between your lat and your, and your biceps, so that when you're rotating that weight up, you're isolating the shoulder rotator cuff and not overusing the deltoid. By the way, your deltoid is popping there, looks amazing, arms looking amazing, but that exercise, we're trying to get the rotator cuff, not the deltoid. So just keep the arm still, and only moving part should be the forearm in a shoulder rotator cuff exercise. And that's many times why you see the physical therapist put the towel between the arm and the side of the body, just to make sure that you're isolating the shoulder rotator cuff. Awesome knee alignment, Adele. That looks fantastic. I love that left kneecap facing right over the second and third toe. Looks absolutely amazing and really nice with that hip hinge. Awesome job. Again, balance is anti-aging, right? And and Carol, keep those arms straight there, because you'll find that you'll overuse the biceps when you do it that way. Overhead press. I like the palms facing the ears and the elbows at a 45-degree angle, just to minimize stress on the shoulder as we work on that overhead pressing endurance, going out all the way up to high half toe here, getting the heart rate up, and working on that triple extension, which is the feet, the knees, the hips extending all at the same time. Very functional. Now we're working on lat endurance here, and again with that cognition cardio. Carol, take the ball out of your knees for this one, so that you can work the outer glutes a little bit more, just to make sure that there's not stress on the inner knee for this one. I like putting the ball between the knees to align the knees in certain exercises, and even doing some agility exercises with them, but not too many, because you want to make sure that the knee doesn't internally rotate, which is a bit too stressful. Mindy, when you sit down on the chair, make sure that you stay forward on your sit bones. Don't let the band pull you back with force and roll too far back on the sit bones, which I know on the fast portion of that, it's challenging. But try to be a little more controlled on the way back, because you gain a lot of strength there when you control the landing, so don't plop. So this note is for everyone. Don't plop down into the seat. It's easy. I love using chairs in the workout, because it gives you that proprioception, that feedback that you're getting low enough to really use that glute on the way up from the chair. But don't put too much pressure on the chair, and don't let the band pull you back. So control yourself on the way back as you sit down on the chair. Really nice work, you guys. Now, awesome stability in the low back, Carmela. That looks fantastic. So really, I love kickbacks when the low back is controlled. It's a great core exercise. Awesome head posture, Adele. That looks absolutely fantastic. We are priming the glute to be so active. I'm just totally booty burn here, because now we're going to the chair, the pistol chair sits, with the leg kicking 45 degrees to the side. Excellent rowing alignment, Nicole. Excellent head posture. Looks absolutely fantastic. Awesome endurance. And again, Mindy, I'm noticing that your wrists are breaking a little bit in these rowing and pushing exercises, and we really want to focus on the what the wrists and the elbows and the shoulders are doing, just to reduce the the risk of inflammation in that wrist area. So I think that's that's going to be something really great to focus on. And everyone, Carol, awesome rowing mechanics. Yep, making a perfect perpendicular angle with that arm. I like to keep the elbow only rowing back to the rib cage, no further back, with these high rep rows, because it's just, it helps to emphasize longevity with that row. It's functional. When you row, when you pick something up off the ground, or you open a door, you really only need to bring the elbow back to the rib. Think pull back with your back of your shoulder, not your elbow. And that's just going to help minimize stress on the front of the shoulder joint, especially if you've had a history of shoulder injury. Why not? Why not just do the minimum effective dose? You're going to get results, you're going to get strong, and you're going to minimize that stress on the shoulder. Here, we're just getting some bicep endurance and some cardio, another round of cognition cardio. And I always work short-term memory. I never remind you of the combo. So you truly are working your mind there. And I love ending with these Superman exercises where we're just emphasizing posture. I think, Mindy, you can even press your chest a little harder into the ground, so the head barely comes off the ground. So you're really working on head posture there and less low back extension, because you can use your lower back to raise yourself way off the ground, like in that swan position. But here, for the purposes of head posture and just, support, mobility of the front of the hip joint and the head, just a little off the ground. Here's a wonderful psoas exercise. I love when a husband comes in, like I said, during the workout. It's so funny. I'm like, come in the workout. The mini ball is under the low back here. Such a safe and wonderful way to work back extension and feels so good after the end. At the conclusion of the workout, we're nasal breathing. We are increasing that parasympathetic nervous system after we exercised both the sympathetic and the parasympathetic within the workout. Excellent work, ladies. This is a wonderful way to release your psoas. Inhaling for 6 and exhaling for 6 on this one. See you at level 5. See you week 5 next week. Thanks so much for joining.